Then they said he's having rapid breathing. So that's another reason we need to take him to NICU. And the doctors were still working on me. So they brought him, he wasn't critical to the point at which they had to rush him off to NICU. Like they brought him back so that I could hold him again before he went to NICU. And then my husband was just going back and forth and back and forth. So I don't know when or why they removed the epidural, but it seems to me that they shouldn't have, knowing the damage that had been done. So I think I was still talking to the charge nurse at that point when the pain started to kick in. And they were like, we didn't let you breastfeed because you had oxycodone in your system, which is something that I took actually throughout my entire pregnancy. My OB said that it was safe. They signed off on it because of the chronic pain issues that I had. I saw perinatal specialists who also okayed it. Like, they're like, this is the safest pain medication that you can be on. So we just monitor you, and that's what they did. But I guess the pediatrician who was assigned to my son when he was born said, no, she can't breastfeed, but nobody told me that. He said, you can't breastfeed just because of the oxycodone, as an abundance of caution. Fine. Why did nobody tell me this at any point? No idea. So it just seemed like they dropped the ball a lot. So I was talking to the charge nurse and I was like, this is more than what my normal pain is. And she was like, okay, well, the epidural is out and we'll give you Tylenol and Motrin. And I was like, okay, I think that's probably a waste of your time, but this is what I take. This is what the dosage is. And this pain is a lot worse than what I'm used to. So, like, none of that was valid to anybody. Nobody understood. So, the nurses went back to the nurses' station. Eventually, the doctors finished what they were doing. My husband and I were alone in the room, and I started screaming. And I was like, you need to go get somebody. You need to go get somebody. Something is wrong. I don't know what's going on. I don't know, anything. So nobody told me that I was hemorrhaging. Nobody. I had no idea what was going on. I didn't find out that I had a hemorrhage until at least the next day. I didn't know that his elbow had come through my rectum until at least, it may have been even two days later that I actually found out what happened. So my husband was running back and forth to the nurse's station saying, like, all of the monitors are going off. Somebody needs to get back into that room. And they just kept saying, like, okay, we'll come. Basically we're doing other stuff. I don't know how, they wouldn't think that a hemorrhage was, kind of an emergency. But I think they said, so once they did the repair, my doctor was saying to me, kind of towards the end of when she was doing it, was that she was having so much trouble sewing the tissue. She actually said that it was like sewing sand. So anytime, she was trying, no matter what she was doing, she said something is going on with the tissue. I don't know what's happening. I don't know why it's happening. I don't know if it's a medication issue. I don't understand. But they eventually, I'm not sure why they didn't transfer me to the OR for it. I think that they were about to, and then things started improving. But, there was blood everywhere. They were saying, they needed however many lap pads, and, they just, everything was like a bloodbath. And nobody told us what was happening. So, everybody left the room. The nurses were kind of like, yeah, we'll get there eventually. We've got other people to deal with. And then my husband came back into the room, and I just started screaming at the top of my lungs, because I was like, this is not the pain that I'm used to. This is not my back pain. Nobody's telling me why I'm in so much pain or what's happening, but I felt like I was dying. And suddenly there were a whole bunch of people in the room. So there were a bunch of doctors, a bunch of nurses. I don't know why or what happened. I don't know if something, on the monitors like alerted them to what was going on. Clearly, Advil and Tylenol did not work. And my blood pressure started to drop. So I think at the worst, it was like 80/50, something like that. It was really low. And because it was so low, they couldn't give me pain meds. So I was just a mess, and I was trying to talk to people and explain, what I was feeling. And then I had a vasovagal episode, and nobody knew, for like 30 seconds or something, what was actually going on. And I've had vasovagal episodes in the past. It didn't connect to me that this is what was happening. And they couldn't transfer me to, the postpartum maternity ward. What they wound up doing was they moved my bed closer to the nurse's station. So it was directly across from the nurse's station so that they could see me, because it was so critical. And I didn't find all of this out until way later. And I was like, shouldn't they've transferred me by now? Like, what's going on? And I remember one nurse saying, okay, well, we have to get your color back to match your hair because you're a redhead. So your face is so, washed out. You have no color. And my husband was looking at me going, she has no color in her face. Her lips are blue. Her extremities are turning color. Like, how are people not like understanding what's going on? There's too much blood. So when they couldn't stop the bleeding, they packed my uterus with gauze completely. And even though they did that, it was still bleeding. They had estimated at that point, I think, that I had lost at least 1.5 liters just from the hemorrhage. So then I think it actually might have been more than that. So once they packed it and moved me across to the nurse's station, I was still screaming, like probably louder than any of the other people who were having babies. Like, just, and I'm usually like one of those like pretty, chilled out, relaxed, polite to people who are supposed to be helping me. And I just lost it because I was like, you have to give me something for pain, and eventually they explained that, we can't give you anything because it will make your blood pressure drop further. And your blood pressure is already so low that we can't do that. So I was in shock, and they just didn't know what to do. And they were on the phone back and forth with my OB trying to come up with a plan. And I think it was probably about 2:00 that morning, the next morning, that they were like, she's lost so much blood, she needs transfusions. So like they came in to talk about that. And like, I didn't realize at the time how critical it is to actually bleed so much that you need a transfusion. Like, I didn't realize how close I came to not surviving, but they had to do 2. So they had to, do all this blood work before they could do the transfusions. They finally came in for the transfusions, and like hours and hours later, one of the doctors came in and said, you're still bleeding. We need to unpack your uterus and see what's going on. And they said, like, we can't do that until you're stable enough that we can give you pain medication, because they still hadn't given me anything. So eventually, after the transfusions and everything were done, my blood pressure started to go back up. I think it was like 90/60, something like that. You know, my pulse rate was like through the roof, and everything was just a mess. And they were like, okay, so we're going to come in and we're going to give you Dilaudid, because this is going to be some of the worst pain that you ever felt in your life. And I was like, great, thanks. This is awesome. So my husband was asleep in the chair again. And the doctor went over and woke him up and was like, this is going to be terrible for everybody. So, essentially we're going to have to, somebody's going to have to insert their hand, and pull all of that stuff out. So they were like, you need to come up by her head and you need to hold her hands. Like, you need to, like, not like restrain her, but also restrain her. And I guess it was like uterinatony and all kinds of stuff like that nobody said any of those words to me. I didn't know any of them until I got my medical records a few months ago, and my son is 22 months. But they gave Dilaudid, and my husband held my hands back, and they pulled out all of the gauze, and I was screaming. And they found another 1.5 liter of clots in the uterus. So overall amount of blood loss, really, really not good. They actually had to bring in a baby scale to weigh them once they got them out. Yeah. So they had to continuously monitor me. Eventually, and at this point, I hadn't been to NICU to see my son. My husband had been running back and forth, and he was kind of going, okay, I lost my brother yesterday. Now I'm going to lose them both. Like, what? I don't know what to do. I don't know what I'm going to do. So thank God for the NICU nurses, because he had no idea what he was doing. Like, he always, before we had Evan, anytime anyone would hand him a baby, he would be like, okay, I'm holding a baby, but I don't know how to put down the baby. So someone would always have to take a baby from him if he was holding a baby and lay them down. And like, one of my friends had had a baby a year before, and she was like, okay, he's, our kid is, sturdy, so he can practice on our kid. And so they gave him, their baby, and he still couldn't put him down. So the NICU nurses had to teach my husband how to take the baby, put him down, change a diaper, do all of this stuff. And he just kind of bounced back and forth. The next day, they moved me because I was stable enough to move. And I was finally able to go to NICU. But at that point, even I wasn't able to stand. I was a disaster. And it's like this weird dazed thing that I still, there's so much of it that I blocked out that, reading the records again, I've been like, oh, right. I forgot about that. I didn't know that this was a thing. Why did nobody tell me that? But yeah, so they got me back to my room after seeing the baby in NICU. And the care that I got, even though this was this amazing hospital, I think it must have been because of COVID, and everybody was short-staffed, and, all of the nurses were exhausted, but I got really not the type of care that I think I would have gotten if the baby had been in with us. Like, people didn't really come in to check to see how I was doing. They brought me a pup. I couldn't breastfeed. And, I expected people to be in and out of the room kind of all the time. And when you go through something that's as traumatic as a 4th-degree tear and all of this stuff, you would think that someone would be checking on you a lot more. So I was just like super frustrated with everything. And then they wanted to discharge me that day. So I lost my mind because they were like, okay, we're going to spring you from here. And I was like, no, you're not. There's no way. They're like, but a vaginal birth, you only stay in the hospital maximum of 2 nights. And I was like, well, do you know what happened to me? Because I don't even know what happened to me, but I know that you're not going to discharge me today. So I was like, I don't care who you have to call. Like, nice Alanna person was completely out the window. I had no patience for anything. I was a disaster. I still had no idea what was going on. Because like I just went into the whole thing completely unprepared, like clueless about any of these things happening. And then they wanted to discharge me. They were going to keep Evan in the NICU, and then we could keep coming back to see him, because at that point he was jaundiced and they couldn't get him to eat as much as they wanted to. But yeah, they were like, we're going to discharge you. And I was like, no, what you're going to do is you're going to call my doctor, and my doctor's going to tell you that you're not discharging me today. And so they did. I had a really great nurse the night that I gave birth, after the not good nurse who dealt with the birth. So it was really great to actually have somebody who was kind of attentive. But then when they transferred me to postpartum, the care was not as good as it should have been. But that nurse actually came to check on me that day. And she was like, I texted your doctor. She's going to call them and tell them that you're not going to be released. So I remember doctor came in that next day, and she was like, it was the worst repair I've ever had to do, because I couldn't get your tissue to go back together. I couldn't figure it out. I don't know why it happened. This is why you tore the way you did, because nobody had said anything about my son having really pointy elbows that can do that kind of damage. But for the rest of his life, he will be hearing about his pointy elbows. That's it. Every time he'll like jab my husband every once in a while, and he'll be like, your elbows are really pointy. And I'm like, yes. So yeah, it was just kind of a disaster. And then eventually they wound up deciding that they would discharge me and the baby at the same time. So he was born on a Friday. They let us go home on Monday. But they didn't have me follow up with my OB for a while. When I was still in the hospital, she was like, okay, so you had a 4th-degree tear. This is what happened. You need to come and see me for your, postpartum appointment at 6 weeks, but you need to go see a colorectal surgeon before then. So I got the name and number for a colorectal surgeon. I still had no idea really what had happened. And I saw her 3 weeks postpartum. And the first question she asked me was, so are you one and done? And I looked at her and I said, it's been 3 weeks. What do you mean, am I one and done? Like, what do you think? You think that that's a thing that I know right now? I don't know. So she said, if you decide that you're going to have another baby, because what happened was so severe, you're not going to be able to have another vaginal delivery. And I was like, okay, good. That's what I didn't want to have one in the beginning. Like, in the first place, didn't want one. But I think that the whole situation did freak my OB out, because she had said, it's a C-section is contraindicated. Well, no. First of all, it wasn't anyway, but I'm fairly sure that she regretted all of that. But yeah, so I saw the colorectal surgeon. She said, I can't do any testing. She did her exams. She said, it's healing, but you now have a fistula, so a rectovaginal fistula. So that was another thing that we had to deal with. I don't know if you want me to explain what that is.
You
Or-
can, you
or-
can, just because some people don't know. I mean, we
Right.
know, but you know, some people don't know, so you can explain it. Yeah.
Okay. So rectovaginal fistula is when there is a hole. So one of my friends actually says that it's like a drive-through um, between your vagina and your rectum. And you wind up leaking poop through your vagina. So in addition to all of the postpartum bleeding and everything that you're already doing, that's a whole other issue, and it can lead to all of these really bad complications. So what she said was, the good thing about this is that when it's due to a birth, those usually resolve. You don't usually need, well, not usually, but a lot of the time you won't need to do a surgical repair for that, because for some reason, whatever reason, I have no idea, those resolve themselves, and mine did. But it was also like, so one more thing that I didn't, want to deal with and have any idea what it was. So that was a lot. And as a result of the tear, I wound up with horrible incontinence. Both, I mean, you have vaginal delivery, you expect that when you sneeze or laugh, you're going to pee a little bit. That I knew. But I was not prepared for the fecal incontinence. And it's funny because I remember reading, like, I used to get these emails while I was pregnant that were like, what to expect. And sometimes these things happen. And I saw that article about fecal incontinence and I was like, oh no, I don't want to do the, how is this a thing? C-section. And my friend was like, you're just reading too much stuff. This isn't going to happen to you.